Well, welcome back, everyone. You know, hernias are more common than most people realize. And while they might not always seem urgent, leaving them untreated can lead to serious complications. So today, we have Dr. Selma El Hag, LMHS general surgeon, here to talk more about hernias and surgical options that are offered. So thanks for joining us, doctor. I appreciate it.
Thank you so much for having me.
All right, well, let's start with the basics. So what exactly is a hernia and what causes it?
A hernia, when there's a protrusion of the intra-abdominal structure, whether an organ or fatty tissue, through the abdominal wall, usually occurs in an area where there's a weakening or a defect in the muscle or the fascia. It happens either genetically, people have some weakened tissue than other people, but also intra-abdominal pressure, which occurs higher when lifting heavy structures, straining, coughing, or obesity.
Okay, so what risks may come with leaving a hernia that maybe leaving a hernia untreated?
Yeah, there's some serious risks that can occur, like incarceration of that protruding tissue, meaning the patient is not able to push it back in if it protrudes out. That can lead to strangulation, which is the cutting off of the blood supply to that structure, and that becomes a surgical emergency. In a less serious note, hernias, if left alone, they can become painful, they can grow larger, they can really affect the daily activities. And that's when we recommend surgical intervention.
Yeah, so what surgical options are available for hernia repair at Lima Memorial?
At Lima Memorial, we have the robotic, which is minimally invasive surgery, and the conventional open surgery. With robotic surgery, we use camera and special instruments, smaller incisions for these patients. With conventional surgery, we make an incision over the hernia to repair it. The recommendations are different based on the patient habitus, the complexity of the hernia, and the presentation at the time.
Yeah, so what can patients expect in terms of healing and then maybe returning to normal activities after robotic hernia surgery?
With minimally invasive robotic surgery, it's a same-day surgery. People can expect to return home. They can expect pain in the first few days that is managed with oral pain medications. In the first 1 to 2 weeks, they can expect to go back to their normal activities. 4 to 6 weeks, they can return to work without lifting restrictions at that time.
All right, so if someone would like to schedule a consultation with you, let's say, how can they reach out?
Patients can call the office and make an appointment with me.
All right, easy enough. And doctor, I really appreciate you coming on, answering those important questions today. So thank you.
Thank you so much for your time.
All right, well, don't go away because we're aboard and we return.